News release. Wednesday, October 18, 2023. Federally funded study provides additional evidence supporting expanded use of telehealth services for opioid use disorder-related care. Starting buprenorphine treatment for opioid use disorder through telehealth was associated with an increased likelihood of staying in treatment longer compared to starting treatment in a non-telehealth setting, according to a new study analyzing Medicaid data from 2019-2020 in Kentucky and Ohio. Published in JAMA Network Open, these findings add to a growing body of evidence demonstrating positive outcomes associated with the use of telemedicine for treatment of opioid use disorder. In Kentucky, 48% of those who started buprenorphine treatment via telehealth remained in treatment for 90 continuous days, compared to 44% of those who started treatment in non-telehealth settings. In Ohio, 32% of those who started buprenorphine treatment via telehealth remained in treatment for 90 continuous days, compared to 28% of those who started treatment in non-telehealth settings. The research was conducted as part of the HEA Link Communities study, the largest addiction prevention and treatment implementation study ever conducted, which is supported by the National Institute on Drug Abuse (NID) and carried out in partnership with the Substance Abuse and Mental Health Services Administration (SAMHS) through the National Institutes of Health's Helping to End Addiction Long-Term Initiative or National Institute of Health HEAL Initiative. This study suggests that telehealth may increase treatment access and retention, strengthening the evidence that receiving addiction care through telehealth is to be safe and beneficial, and that it should be made available to those who need it, said Nora Volkow, MD, Director of NID. To quell the unprecedented loss of life from the overdose crisis, we must continue to prioritize both increasing access to treatment and providing the care and support people need to stay in treatment after they have started. Prior to 2020, people with opioid use disorder were required to meet in person with a health care provider to start treatment with buprenorphine. After the onset of the COVID-19 pandemic, the United States government implemented prescribing flexibilities to facilitate buprenorphine access for patients with opioid use disorder. These updated policies allowed clinicians to remotely prescribe buprenorphine to new patients via telehealth without conducting in-person examinations, expanded payment for telehealth services, and provided flexibility on accepted communication technologies to deliver clinical care for people with substance use disorders via telehealth. To investigate the impact of these policy changes on patient outcomes, researchers led by a team at the University of Kentucky, Lexington, analyzed Medicaid claims and enrollment data from NAV 1 2019 to DEC 31 2020 for individuals aged 18 to 64 years in Kentucky and Ohio. They found that nearly 92,000 people within this data set had a buprenorphine prescription in at least one quarter of 2020, and that nearly 43,000 of those people started treatment in 2020. They also found significant increases in telemedicine delivery of buprenorphine following the more permissive telehealth flexibilities implemented during the COVID-19 pandemic. Because starting treatment with buprenorphine via telehealth was rare prior to and during the first quarter of 2020, researchers then looked at a smaller subset of data from individuals who started treatment with buprenorphine in either the second or third quarter of 2020, including 9,172 people in Kentucky and 12,328 people in Ohio. In both states, starting treatment via telemedicine was associated with higher likelihood of staying on treatment for a continuous 90 days. The authors also found that receiving buprenorphine treatment via telehealth was not associated with an increased likelihood of non-fatal overdose, providing additional evidence to suggest that patients were not harmed by having increased access to buprenorphine treatment through telemedicine. The use of medications to treat opioid use disorder can be an incredibly effective method of reducing overdose deaths and helping people achieve recovery. However, for too many Americans, accessing these medications is incredibly difficult, said Miriam E. Delphin-Rittman, Ph.D., the HHS Assistant Secretary for Mental Health and Substance Use and leader of SIMHSA. This study shows that telehealth is another important tool for increasing access to this life-saving medication. Importantly, some groups were less likely to receive treatment for opioid use disorder via telehealth and were less likely to remain in treatment through the continuous 90-day period. These included non-Hispanic Black individuals, men, and those who had experienced a prior overdose involving opioids. The authors note that additional research is needed to continue to examine the impact of telehealth on patient outcomes, beyond the Medicaid populations in Kentucky and Ohio, and beyond the year 2020. Our study suggests that people who have access to telehealth treatment for addiction seem to do better than those who do not. Our hope is that these findings can help inform future policy, said Lindsay Hammerslag, Ph.D., assistant professor at the University of Kentucky and lead author on the study. In addition, the findings also emphasize that the benefits of telehealth are not reaching all populations equitably. As we continue to integrate telehealth into standard care, we must also investigate and address the barriers that are preventing people from accessing this helpful and effective form of treatment for opioid use disorder. Helping to End Addiction Long-Term Registered and National Institute of Health HEAL Initiative Registered or Registered Service marks of the Department of Health and Human Services. For more information on substance and mental health treatment programs in your area, call the free and confidential national helpline 1-600-662-HELP-4357 or visit www.findtreatment.gov. About the National Institute on Drug Abuse NID is a component of the National Institutes of Health, U.S. Department of Health and Human Services. NID supports most of the world's research on the health aspects of drug use and addiction. The institute carries out a large variety of programs to inform policy, improve practice, and advance addiction science. For more information about NID and its programs, visit www.nida.gov. About the National Institute of Health HEAL Initiative, the Helping to End Addiction Long-Term Registered Initiative, or National Institute of Health HEAL Initiative Registered, is a National Institute of Health-wide effort to speed scientific solutions to stem the national opioid public health crisis. Launched in April 2018, the initiative is focused on improving prevention and treatment strategies for opioid misuse and addiction and enhancing pain management. For more information, visit healnay.gov. About the National Institutes of Health, National Institute of Health, National Institute of Health, the nation's medical research agency, includes 27 institutes and centers and is a component of the U.S. Department of Health and Human Services. National Institute of Health is the primary federal agency conducting and supporting basic, clinical, and translational medical research and is investigating the causes, treatments, and cures for both common and rare diseases. For more information about National Institute of Health and its programs, visit www.nate.gov. National Institute of Health Turning Discovery into Health Registered. L. Hammerslag et al. Telemedicine, buprenorphine initiation and retention in opioid use disorder treatment for Medicaid enrollees. JAMA Network Open. DOI 10.1001/JAMA Network Open 2023.36914 2023